Where do we go from here? Sabin's social and behavioral research grant partners, in the course of a year, have worked with their communities to co-design research projects and interventions to improve vaccination acceptance, demand, delivery, and decision-making. In Part 3, we learned about the key findings from this important work, but the journey isn't over. Diagnosing the problem isn't enough. Our partners, with their community interests at the forefront, describe how they plan to turn evidence into action.
It's important that we as public health researchers continue to do what we are doing, but try to be more specific, like in our different sections, lecture, try to tailor your message so that it targets a particular population. In this, it gives you a real evidence-based results that can be used to take actions.
A point that should be taken into consideration is to get people to trust in the health system, because it's not the vaccine the problem. The problem is the conditions in which the vaccine is going to be delivered. If you don't strengthen the trust in the institutions and in the healthcare workers, how do you expect that vaccines can be properly delivered? And how do you expect to increase the vaccination coverage if you don't trust in the people that are going to provide you the vaccine? So instead of creating short-term solutions, we need to think in long-term structural solutions.
Given the paucity of data on vaccine acceptance and demand in people living with HIV population, we have seen so far critical insights into vaccine needs of Thais living with HIV, and we hope that our efforts will result in a better understanding of the facilitators and barriers to COVID-19 vaccination, inform public policy, and prioritize COVID-19 vaccine access in this population, and help refine interventions for better health outcomes in this vulnerable group.
While we speak about ethical research and while we speak about looking at autonomy, justice, beneficence, non-maleficence as principles of ethics in research, it's important to understand that these principles are going to be safeguarded only when the research is not on the community, but with the community and by the community. And that is why community-based participatory research takes the ethical approach to medical research or human research a step further, by ensuring that the people who are part of this research are the ones who are designing it, are the ones who are monitoring it or controlling it.
My recommendation, as well as my biggest takeaway on this project for countries that want to implement similar intervention, is to engage the community, to co-create and co-disseminate interventions that respond to their need, right? It gives them a sense of ownership, and it will also, promote participation in the program. In our own case, it was, promoting demand for vaccination. Currently, COVID vaccine is in adequate supply now in Nigeria, and this is one thing that program managers need to look into, perhaps, deploying a more mobile vaccination team, to this remote area to bring vaccines closer to people. An aspect of our research that can be replicated in their own in other country contexts would be to, work with the program managers at the lower level as well as the community, to identify trusted community members to deliver your intervention, and also using existing community structures. So there could be women meetings, youth meetings, associations.
I love the fact that I am working with communities and I'm working to elevate the community voices and their desires, their feelings, and learning from them. I really, really love that. Traditionally, we think about research as people in ivory tower generating all the knowledge, but no, this type of research really turns the focus on the people themselves, and the people are the ones generating the knowledge that will help them, and then in the long run improve immunization uptake and coverage.
It's important for us to be humble about what we might know and what we might not know, and equally give respect to all the stakeholders that we work with. That's extremely important, especially when you're working with marginalized communities who've been historically discriminated against. So part of being a good public health professional or a researcher is actually then figuring out mechanisms where you can open yourself to learning those sort of insights. And for that, what do you need to do, especially from a trust building perspective? Because you could go in and not learn anything if you come with a certain arrogance. You really need to be open to having those conversations on an equal basis where you give them the same importance as you would give to any other stakeholder, and then trying to really understand where they're coming from, what they're trying to communicate. So hopefully, future public health professionals will be trained also better, and future medical and clinical and health professionals will also be trained better to be able to know what their patients might be coming up with and how they provide more affirmative care, which is respectful in nature and quality as well.
It is very important to adopt the human-centered methodology because that gives us a clear understanding of what the situations or the issues are. Within this space, we are usually used to using the top to bottom approach, in which cases have shown not to be very effective. But the human-centered approach creates a sort of bottom to top approach where we get to the root cause, we identify what the issues are, and we are able to address those issues.
My biggest takeaway is that when you engage individuals in discussions with an open ear and actually build relationship, that vaccine uptake becomes a secondary issue because people actually engage and are willing to do so. They just want to be heard. So being able to have thoughtful discussions about what is a barrier, how to overcome it, and then to let people make their own decision. We actually have learned that people are very willing to actually take up vaccines. They want to be healthy. They want their children to be healthy. And it took sort of that process of engagement and community involvement.
Global leaders should invest in supporting research that generates information from communities, with communities, about what works best to boost their demand for vaccination and their uptake. So that community-centric research is really, really important, and it has to be funded. That's the first thing. Then the second thing I would say is that the research should not just stay in peer-reviewed journals or stay in reports, beautiful reports that are written and decorating shelves. They should be translated into policy. They should be translated into programs. They should be translated into action. So that translation piece has to also be given the right amount of attention. And then the third thing is to create forums, exchange forums, where researchers can come together, cross-learn, improve their craft, as well as bring researchers and practitioners together so that this research makes it right into programs and policies.
Some of the themes that have emerged from this research to date include that people closest to decision-making on vaccines must be engaged and re-engaged over time to build community trust. Multi-sectoral and multidisciplinary collaboration and sharing of real-time evidence-informed lessons learned can have a truly positive impact on building and sustaining vaccine demand. Localized research must be conducted from diverse regions to inform interventions that could work best for each community. By design, this investment is linked to Sabin's approach to foster broader engagement of geographically and disciplinary diverse immunization experts through Sabin's Vaccination Acceptance Research Network, the VARN. Rapid sharing of case studies, both successes and failures, provide pathways for replication of successful strategies in similar settings. At Sabin, we believe the best way to reverse current immunization declines is to invest in bottom-up approaches, multidisciplinary community-based research that centers local communities as the key experts in unpacking and implementing strategies to address vaccination acceptance, demand, delivery, and decision-making. Vaccine confidence, acceptance, demand, and uptake requires it.